Welcome to the Evidence Hour, Cultural Responsivity and Domestic Violence Intervention Approaches for Immigrants in the U.S. The Center for Victim Research is holding these Evidence Hour webinars to showcase systematic reviews and meta-analyses and scoping reviews that examine an issue of importance to victim service providers, advocates, researchers, and others. It is my pleasure to introduce today's speakers. Aba Ray is an assistant professor at the School of Social Work at Loyola University in Chicago. Kristen Ravi is an assistant professor at the College of Social Work at the University of Tennessee, Knoxville. And joining them is Radhika Sharma. She's the manager of outreach and education at Apnagar, a multi-service agency addressing gender-based violence in immigrant, refugee, and other marginalized communities. And with that, let me turn things over to Aba.
Thank you so much, Susan. So as Dr. Ravi actually pulls up the slides, I'll introduce myself briefly, and I'll also provide my wonderful colleagues the opportunity to introduce themselves. My name is Dr. Abha Rai, and I'm an assistant professor at Loyola University School of Social Work, Chicago. My area of research interest broadly relates to domestic violence and well-being among immigrant and refugee communities. I'm also interested in immigration policies and the impact of such policies on immigrant and refugee lives. I'm really excited to be here today for this webinar titled Cultural Responsivity in Domestic Violence Intervention Approaches for Immigrants in the US. Here we will be sharing with you some findings from our scoping review, as well as share some of our reflections in conducting research with these communities and then engage in some practice implications. Today, I have with me two of my wonderful colleagues, Dr. Kristen Ravi from University of Tennessee, Knoxville, and our community practitioner expert, Radhika Sharma from Apnagar. I will now invite Dr. Ravi to introduce herself.
Thank you, Dr. Rai. As Dr. Rai mentioned, my name is Dr. Kristen Ravi. I'm an assistant professor at the University of Tennessee in Knoxville, and my research focuses on the impact of domestic violence on survivors and their children. And one of my areas of interest is domestic violence among immigrant survivors, and I'm very much looking forward to sharing our findings from our scoping with you all today.
Thank you, and my name is Radhika Sharma Gordon. I manage education and outreach at Apnagar, a nonprofit located in the Chicago area that's been working for about 31 years now to address various forms of gender-based violence in primarily immigrant and refugee and otherwise marginalized communities, and so have been in the field myself for about 31 years.
So today, in talking about our scoping review, we'll start with some learning objectives. We'll give you a background of our scoping study and the literature on the topic. We'll then spend some time on our methodology, moving on to discussing some of our main findings, and then going into the main part of our webinar today, which is highlighting some implications for researchers as well as practitioners and how their role can be enhanced while engaging with immigrant and refugee communities. And then we'll have some time for questions and answers in the end, but please feel free to send us comments, questions throughout using the chat feature and the question feature. And Susan has very graciously agreed to help us manage those questions.
So let's start off with some learning objectives. By the end of our presentation today, it's our hope that you all will understand the need for culturally responsive domestic violence services for immigrant survivors, as well as the extent to which culturally responsive domestic violence interventions are utilized. We will also discuss the role that practitioners play in engaging immigrant survivors of domestic violence. We'll be differentiating cultural responsivity from cultural competence, and we'll be highlighting the implications of our scoping review on research, practice, and policy. So now let's begin with some background information. We'll start by discussing immigrants and domestic violence, as well as the number of immigrants in the US. So currently, immigrants comprise 13.7% of the US population, and the majority come from Latin America, Asia, Europe, Canada, the Middle East, and Sub-Saharan Africa. Regarding the prevalence of domestic violence, it's estimated that every minute, 20 people experience some form of domestic violence. This averages out to be approximately 10 million male and female victims annually. Existing research tells us that Latinx, South Asian, and Korean immigrants experience higher rates of domestic violence victimizations that ranges from 30% to 60%, which is significantly higher than the prevalence rates for non-immigrant women. And we'll discuss the reasons for that shortly. So when addressing domestic violence among immigrant survivors, it's helpful to utilize an intersectionality lens. Intersectionality recognizes that the interaction between multiple identities and how they impact survivors' experiences of domestic violence and help seeking, and the compounded nature of oppression that's experienced by immigrant survivors of IPV. Immigrant survivors of domestic violence face a host of unique challenges as a result of their intersecting identities. For instance, there's a lack of access to domestic violence services due to language barriers when services are not offered in the client's language or when interpreters are provided, which we'll talk quite a bit about in our presentation. And frequently, immigrant survivors may fear deportation when they're seeking services, and that's deportation of potentially themselves, their partner, or their children. Some immigrant survivors are less likely to seek formal domestic violence services due to the fear that it could bring dishonor or shame on their family as a result of cultural norms. Therefore, culturally responsive interventions are needed to address their specific needs, as well as research that focuses on culturally responsive research with immigrant survivors. So before we move forward to discuss the scoping review that we conducted, it's important that we discuss the factors that impact domestic violence in immigrant families. First, many immigrants come from traditional societies that have very defined gender roles and expectations, and often result in men holding more power in the relationship. And this kind of asymmetrical power structure has been associated with a risk for violence. Frequently, women migrate with their male partners as dependents, which give men more power in the relationship. This dependent status of immigrant women has been linked to experiencing domestic violence. Often, abusive partners may attempt to prevent survivors from fleeing by denying access to their documents, their financial resources, or their transportation, such as by preventing them from obtaining a driver's license, which then increases the survivor's dependency. And in addition to abuse by their partners, immigrant survivors may also experience physical and psychological abuse from their in-laws. And this can include isolation, economic and verbal control, domestic servitude, where they're forced to take care of everything around the house and act like a servant, as well as being delayed access to food. So they might be required to eat last or eat food that's poor quality. And as mentioned previously, immigrant survivors are often hesitant to seek help due to the mistrust of formal service sectors, such as the criminal justice and domestic violence services, due to the stigma and fears of deportation. And I'm so sorry if y'all are picking up on the construction that's happening outside of my office. It's really loud and I'm very sorry, and I hope that it's not interfering too much. So also it's important to note that the oppressive deportation policies that were created under the Trump administration have really exacerbated this fear around deportation. And also, more often than not, survivors will seek help from their friends or family, who may encourage the survivors to stay in the relationship or perhaps even blame the survivor. So the research questions that guided our study included: what are the types of culturally responsive interventions, and how is cultural responsivity incorporated into domestic violence interventions for immigrant communities? So a little bit about how we found the studies. We did a database search of several of electronic databases that Dr. Rai will discuss momentarily. But in order to locate relevant studies, we searched those 11 databases using keywords that were related to domestic violence, immigrant and their synonyms, and intervention, and so synonyms for all of those different terms. And we consulted a social science librarian to make sure that our search terms were effective and we were not missing out on any studies. Studies were included if they were published in English in a peer-reviewed journal between 2008 and 2020, and we included both conceptual and empirical articles. And conceptual articles refer to papers that describe the cultural responsive intervention more descriptively versus empirical studies that are more focused on testing, but Dr. Rai will talk a little bit more about that in just a couple minutes. So it's important to note how we defined cultural responsivity. And so for our definition, we define cultural responsivity as any discussion of power and oppression, positionality, culture, values, or norms, language, acculturation issues, or immigration-related structural barriers, such as visa-related challenges, relationships with the criminal justice system related to their status, and other systems of power. And so our initial search yielded 1,700 studies. And then after we removed the duplicates and completed the initial screening, we were left with 15 studies that met our criteria. Dr. Rai, will you please walk us through our findings?
Definitely. Thank you so much, Dr. Ravi. In terms of our databases that we used a variety of databases just to make sure our findings were comprehensive, and the list of articles that were actually included in our search were also comprehensive. All of these databases were accessible through our own university library systems. Studies varied across these databases, and we had more studies in one database as compared to the other. Next. In terms of the number of published articles, as you can see, it was between 2008 to 2020. There were at least 2 or more articles in 2009, 2013, 2014, and 2019. Next. Looking at the types of published articles, we had 3 that were mixed methods, which basically means that they were both qualitative and quantitative in nature. We had 4 that were purely qualitative articles. We had 2 that were quantitative, and then we had 6 that were conceptual, which means that they were either describing the intervention that was built or a theoretical framework that was used to build an intervention, and it was not actually qualitative or quantitative in nature. Next. So coming to some of our geographical locations and looking at our main findings, most of our articles that we included were conducting research, or they were talking about culturally responsive interventions within the Midwestern US and Southeastern US. 9 studies developed interventions for Latinx immigrants, 2 for Korean clergy, 1 for Chinese immigrants, 1 for Indian, and 2 for immigrants and refugees broadly. We had interventions that were serving a variety of population, meaning they were both for men and women, survivors, bystanders, as well as abusers. Next. Thank you. In terms of also some of our other salient themes that came out through our study, now also wanting to remind you that the main goal of our study was to look at domestic violence intervention, yes, but also the extent to which cultural responsivity was included in those interventions. So similarly, linking our findings to the goal of our paper, we found that ways in which interventions were made culturally responsive was by integrating community norms like patriarchy, gender role stereotypes, values such as feminismo, marianismo, and machismo, as well as highlighting values around the community, such as Hindu values of peace, Christian values of harmony, etc. Also, ways in which the interventions were disseminated were through online simulations, peer engagement, street plays, as well as trainings. For example, we saw one intervention by Yoshiyama and colleagues was actually conducted in the form of a street play where the people who were disseminating the intervention, the researchers and community organizers put together a street play which highlighted patriarchal community norms and solicited responses from bystanders. And another intervention by Fuchel and colleagues was also built around values on generating equity between male and female partners, as well as reducing gender inequity and work distribution in the family household. Next. So looking at our implications, some of our main research implications were that this is really the first study to investigate culturally responsive interventions among immigrant communities in the US. IPV or domestic violence looks very different across different immigrant communities. Like Dr. Ravi was saying, it could manifest in the form of abuse through in-laws, immigration abuse, threats of deportation, giving old food, taking away jewelry, not having access to insurance, all of these different things. That's why one size does not fit all, meaning one intervention that's mainstream, that it cannot be applied across different immigrant communities. So this was what sort of was brought to the forefront through our research study. So in thinking about practice implications and this idea that one size does not fit all, how do you see this manifest in your work with Apnaghar and otherwise in the community, Radhika?
Thank you, Ava. Absolutely, the one size fits all absolutely does not work for us. So Apnaghar was started by 5 Asian American women in 1989 in response to primarily at that time South Asian survivors of domestic violence who were saying, I can't go to the mainstream shelters, I can't keep my Hindu vegetarian or Muslim halal diet or kosher diet, etc. And I need the language, I need to be able to have a space to pray 5 times a day. It's Ramadan, we need to be able to cook our evening meals after sundown and prayer, and it would be great if there were dates around, because at Ramadan that's how we break our fast, is with dates. Those types of things that often aren't offered in a lot of mainstream shelters, especially 20 or 30 years ago when we started. So those are some of the things that are ways that we've broken the mold or have expanded the model of response. Also recognizing that immigrant and refugee survivors are suffering from things that you've mentioned, such as the visa issue. There are some survivors who've come over here with their partner, and they're both educated professionals. However, they've come over on a visa that's only allowing their spouse who is abusing them, to work, and they, as a spouse, usually the wife in the relationship, even though well-educated and professionally trained, cannot work because they have visa limitations that don't allow them to work in the United States. So those are some of the positionality issues that we have to consider in addressing survivors who want the abuse to stop and want to have some sort of greater power and access to finances, but are very limited in their ability to earn and to access money. It's really important to ask things such as, do you have access to a bank account? Do you have access to your immigration papers and your passport or your visa? Do you fear great verbal or physical harm if you spend more than a certain amount, et cetera, et cetera? Trying to gauge the scope of coercion and punishment around issues of being able to access your papers, your immigration papers, being able to spend money, et cetera, things like that. And then a lot of the survivors who come to us also need better solutions that are more than the primarily carceral, calling the police, possibly pressing charges, maybe going through divorce court, etc. Many of them say, I don't want to leave the marriage. I am not prepared to do anything else. I was not trained to do anything else other than, manage our household. And I just want the abuse to stop. And so, as our larger domestic violence movement is finally awakening to the need for going beyond the carceral approach, we need to find other ways of achieving safety for survivors and accountability for those who have harmed that don't always involve the police. We need other ways of saying, how can this survivor be safe, and how can this person who's causing harm be held accountable, and what are the other means that can persuade them that to stop the abuse. And can we also create abuse intervention programs that are much more culturally sensitive and culturally engaged and culturally relevant to those who have committed harm and who either are choosing to or are mandated by the police or by child welfare to attend abuse intervention groups. We need those groups to be as culturally accessible as possible if we are going to see a change in amongst the people who do commit harm. And back to you, Abha.
Thank you so much, Radhika. You bring up really important points in terms of practice implications, and I 100% agree. More education around immigration laws, immigration policies, work visas, and concerns around that. It's important for us to talk to our community so that they understand the services that are available to them, the types of services that they can access when facing challenges around seeking a work permit or not being sure about ways in which they can actually leave the abusive relationship if they're on dependent visas. Another thing that came up through our research was that there's limited research regarding cultural responsivity among immigrants in general, but even more so limited when thinking about African immigrants. So that was a glaring gap that stood out to us. In terms of practice implications, again, Radhika, what have you noticed about ways in which community agencies have been responding to diverse immigrant communities? And are there some communities that are less supported or that have limited programs or options in terms of accessing help as compared to the others?
Absolutely, but thank you. And I would say that the categories around engagement include outreach to communities and increasing their awareness of their rights and the resources and the remedies available to them. And since so often in an abusive relationship where the person who is being abused is an immigrant or a refugee, very often, we all know in the domestic violence community that very often that vulnerable immigration status is often part of the power and control, part of the coercion. You will be deported if you go to the police. I will be deported if you go to the police. You are going to ruin your family's name if you try to leave me or you have me arrested. All of those things where the immigration privilege is often used as a weapon and tool of coercion and control. The other thing is outreach and education and increasing people's awareness of the rights that they have here that are very different maybe than the law is back home regarding custody, child custody, regarding the difficulty of being able to prove abuse, that witnesses are not needed as much in seeking a domestic violence order of protection, establishing a credible case that yes, this person is harming me. One of the other things that we know is that, as you've mentioned, some of the newer immigrant refugee communities, including, yes, very much a variety of African communities, sub-Saharan communities, where there is so much strife going on and different waves of people coming as refugees here, very often not being aware of their rights, not being aware of resources available to them, and they're not being well-established connections between domestic violence, sexual assault, and other such agencies connecting with immigrant mutual aid organizations, refugee resettlement organizations, and then structures such as the schools and the schools' ESL programs and their bilingual advisory councils, the parents of the ESL students, and the person who is the ESL coordinator in the school. Those are often really great conduits into engaging new Americans, parents who have emigrated here recently or who have been here for a while but recently brought over their children. The children's need for understanding, their rights if they're being, sexually harassed or in a dating violence relationship, in the school, etc. Both the adults and the children needing to know more about their rights and the remedies, and resources available to them. I think also we, so there are those different outreach channels that all of us in the domestic violence and sexual assault fields need to be aware of and to engage communities more. We all need to have more translations, written translations of our awareness posters and signs in schools and in immigrant and refugee serving agencies about the rights of survivors and what is considered to be domestic abuse here in the United States. So translated information so it's accessible in that way, and then also keeping in mind there are some more recent immigrant and refugee communities such as the Rohingya, in which many of the community members are not literate in their language. And so there is the need for more spoken, recorded videos about domestic violence, what it looks like, what the rights and remedies are, and the various community agencies, and that services are free and confidential. All of these things it need to be, yes, translated, written translation, as well as videos being available and, infographics available whenever possible to help overcome language barriers and to ensure that responders such as the police and sectors such as the courts have access to well-trained interpreters. I cannot tell you how many times many of our Upnagar or some of our sister organizations have taken survivors to court only for the survivor to be turned away and saying, no, you cannot even go before the judge today to petition for a domestic violence order of protection because we can't accommodate your language need. And so that's often a problem. And then other sectors, such as the child welfare sector, with an immigrant or a refugee survivor of domestic violence is being investigated by child welfare. Their custody of their children is at stake. Very often there is very poor language access. And so sometimes they might be pressured by a child welfare worker, to an advocate to make sure that the parent understands everything that's being done in this child abuse investigation. And so very often they are receiving lesser than services than people who are able to communicate more easily with the courts, the police, child welfare, at the schools. And I think so those are just some of the things that we know are some of the gaps. And then there are things like our shelter kitchen allows for survivors to cook their own meals. and things like that. Those are just, and we celebrate Ramadan and change the kitchen hours during Ramadan so that they can cook later in the night, etc. Back to you, Ava.
Thank you so much, Radhika. And these are, wonderful implications for practice and when thinking about translation of research into practice. We'll get to some more practice implications in just a few moments. Could you help us with the next slide, Dr. Ravi? So some other things that Radhika touched upon right now and that came up in our research was that interventions need to be made available in many ways, including online, offline, different modes, interactive ways of disseminating research or interventions, so people are actually able to utilize and engage with researchers when it comes to interventions. And of course, interventions need to be made available to bystanders, family members, so that domestic violence is not just something that a survivor has to go through themselves. क्रिस्टन, मैंने अभी तक जो भी बोला आपको समझ में आया? मैं इतने देर से हम लोग अपने पढ़ाई के बारे में आपको बोल रहे थे और इंटरवेंशंस के बारे में बोल रहे थे, आप सुन पाए? So what do you think, Dr. Ravi?
Well, I just heard intervention, but I have no idea what you said beyond the word intervention.
Well, exactly our point, and similar to what Radhika was saying in terms of language access and really making sure that the intervention is accessible, translation using languages or words that actually make sense to the community is extremely important. So in just thinking about that, Radhika, are there any new initiatives that Apna Ghar is working on or has worked at in terms of language translation when engaging with survivors? Would you like to highlight something?
Yeah, just there will be some slides later on that list some of the great resources, such as the Hot Peach pages, the Asian Pacific Institute on Gender-Based Violence, the National Latina Network, all of these organizations that have translations of key terminology in serving survivors or victims, and then also language access plan templates that a domestic violence or sexual assault agency can use in creating their language access plan. And then just to all of the things I'd mentioned earlier, also making sure to reach out to English as a second language and citizenship preparation classes to make sure that new Americans utilizing, learning English and learning to prepare for their citizenship exam, folks who are, at high risk are also receiving information on their rights. And this can be even infused into a lot of the lessons that are taught in, say, an English as a second language class, at the intermediate and advanced level. Back to you, Abha.
Thank you. Next. So circling back to some of our other findings that came up in our research were that there is a need to engage with family members, bystanders, really everybody to educate and have conversations around dismantling patriarchy, moving away from traditional archaic gender roles that disadvantage a particular group as compared to the other. There is value in integrating community norms into interventions so that we're able to appeal to the values inherent in certain communities. Along the same lines, we also noticed in our research that there are some gaps when thinking about the synergy between research and practice. So there were some recommendations that we made in terms of engaging better with practitioners, when thinking about designing research studies, more community-based participatory research, more community-based approaches. So in thinking about this gap between research and practice, what are some suggestions for improving these gaps, Radhika, or is there a way for us as researchers and scholars to think more responsibly when thinking about research with our immigrant and refugee communities and supporting the needs of our practitioners and community agencies?
Well, in order to save time, I do have a wish list that I can include as a handout after folks do complete their evaluation in terms of what you receive, the materials you will receive after handing in your evaluation for this seminar. But really quickly, making sure that we create interventions and research the efficacy of these interventions that engage organizations like Immigrant and refugee mutual aid organizations, like refugee resettlement organizations, and anybody who is providing ESL education to people who are working with entire families, to train them to address domestic violence that emerges in a family whom you're providing case management, or people who are program participants. We need that rather than the traditional way of like a client comes to a domestic violence organization referred by a family member, a past client of the agency, or their lawyer or counselor. We need to find ways for organizations that are serving entire families to be able to detect, respond to effectively, and ensure the confidentiality and as much as possible provide for the safety of a survivor who is a program participant of theirs. And then also I just really encourage researchers and practitioners to just form ongoing relationships with organizations engaged with immigrant refugee communities, and especially your real gold in grassroots connections will be people who are providing interpretation, who are themselves who are themselves refugees and immigrants who are now working or volunteering as interpreters for a lot of these organizations. They have their ear to the ground, they know the community, they have the cultural in-reach into the community, and they can be very useful both as research conduits and in conducting outreach and in giving us important feedback about whether or not survivors from immigrant refugee communities have found our services, our hotlines, our counseling, our shelter to be helpful, and what was not helpful, and how we can better serve them. So it's really important to engage with folks like that who are in some ways grassroots leaders. And back to you.
Thank you so much, Radhika. Now I'll invite Dr. Ravi to wrap us up with the last segment of our webinar. And if there's opportunity later on for Radhika to highlight a little bit more, I know I want to be conscious of time, but I think this discussion is extremely important for all of us here today. If there's ways in which we can also start to think about assessment in ways that are culturally responsive. So when thinking about domestic violence assessment tools, if there's ways in which we can make them more responsive to integrate questions around immigration abuse through in-laws, in-laws taking away jewelry, food, if there's opportunity for us to delve into that some more, we'll try to do that in the end. Dr.
Absolutely.
Ravi.
Oh, sorry, go ahead.
Okay, so thank you, Dr. Rai and Radhika, for that really nice discussion of the implications. That was a really engaging conversation. So I just want to wrap up in terms of our recap of what we found. And so basically, in conclusion, it's important that domestic violence interventions for immigrant survivors do not take a one-size-fits-all perspective. And so when service providers are providing culturally responsive interventions, they're better able to engage with the immigrant communities. And in addition to utilizing culturally responsive interventions, it's critical that service providers assess for domestic violence using culturally responsive measures, since these types of assessments, typically mainstream assessments, may not uncover some of the forms of coercion or abuse that may be occurring within immigrant communities. And Dr. Rai had spoken a little bit about what some of those might be. And so we'll come back to that. But further, it's imperative that service providers provide a timely response and appropriate service for immigrant clients and communities. And there are some policy implications that stem from the finding of our study. And so Radhika had talked about the different visa status and how often survivors come over on a dependent visa. And so it's really important that service providers advocate for independent visa options for immigrants so that survivors are not dependent on their abusive partner. And then immigrant survivors are also made aware of the provisions that are included in the Violence Against Women Act that allow for survivors to self-petition for immigrant status, such as U visas, which are specific for survivors of mental and physical abuse. And as we mentioned earlier, language access is critical in engaging survivors. Radhika, could you take a couple of minutes to share with us a little bit about language access and some of the resources that practitioners can utilize, as well as some of the work that Apnagar has been doing? Maybe about 2 or 3 minutes.
Right. Thank you, Kristen. First of all, if you are doing an online hotline form or an intake form, consider or your organization having a pull down menu for, like, if survivor is either an immigrant or refugee or is partnered with somebody who is an immigrant or refugee, ask them about things such as, what has been mentioned, not is anybody, not just your partner, but use language such as, is anybody you are living with harming you, hurting you, threatening you, demeaning you, etc. Also, to ask whether there are things such as, not assuming, but asking respectfully, are there issues around pressure to, forced marriage? Are there issues around being harassed because your family didn't bring in enough dowry when you married their son? Are there issues such as I am a teenager of a refugee or immigrant family, and my family is saying that they're not going to pay for college unless I undergo female genital mutilation? I mean, it's a much lower occurrence, but it is happening, and it's happening in the United States. The female circumcision or female genital mutilation and pressures around that. So the way that immigrants and refugees are experiencing family violence can take on many forms, and we need to find respectful ways to ask about it. Really quickly, making sure that you are prepared for an intake or a drop-in or a hotline call, that every staff knows how to respond if somebody calls and is speaking a language other than the language spoken by your staff, and hotline volunteers, etc. Looking at materials that are already translated. Apnagar has translated into very simple English, reviewed by English as a second language ESL instructors, crime information sheets that explain various crimes that commonly target immigrants and refugees. We also encourage you to find good ways of identifying the name of the language being spoken. This next slide here it looks much prettier than this, the handout, but this is a form that we are happy to share with people, which lists the name of a language and in the script of that language, along with the English name for that language. And so using these language identification sheets to help make sure that you know what the language is, and then to be able to contact an interpretation service to, say if your state has a linkage through your state hotline or through the National Domestic Violence Hotline, they sometimes can provide live phone bank interpreter phone assistance, things like that can be really, really helpful in ensuring that survivors don't suffer in silence because there's a language barrier and they're not able to fully express themselves and engage and tell their full story because people don't understand the language. And so call ahead of time if you have a client who's you're working with who doesn't speak English, and all right, tomorrow we're going to go to the WIC office, and the day after that we're going to go to court. call ahead to those offices and let them know, tomorrow I'm going to be bringing in a Mandarin speaking survivor. Can you please make sure that you have a Mandarin speaking, either, phone interpreter or live interpreter, in person. Give the survivors whom you're serving who do not speak English these I speak, and then the name of their language and need an interpreter cards that they can pull out and show to people if the police are coming to their house or if they're going into an organization seeking services. And that at your state level, working with VOCA and STOP grant administrators to say we need to earmark money from these federal funds coming through the state, coming to us through the state administrator. We need to make sure that there are funds that are going to cover the cost of a language interpretation line that we can all have access to. My understanding is it's being people are finding much more success at the state level than trying to advocate federally for interpretation costs, covering the costs of an interpretation line account. And then we need to remind everybody, any of us who are receiving federal funding, even rural police or sheriff, if they have Kevlar vests, that's most likely come to them from federal funding. All of us are obliged under the 1964 Civil Rights Act, Title VI. We are all ordered to provide reasonable access, reasonable language access, so that nobody suffers for inferior services or being denied services because a service provider cannot meet their language needs. And so, we're violating their civil rights when we are not providing them full and equal services. And we have to think about that and talk about what is being done around language access.
Thank you so much, Radhika, for that discussion of the barriers around language and some of the resources available. What I'd like to do now is stop for questions, and some additional resources are available on the PowerPoint that the attendees will be provided after completing their evaluation. But I would like to stop and invite for any questions that any attendees may have for us.
Great, we've had quite a few interesting questions come in, and folks, remember, you can enter your questions in the question box. One that came in early is, what other cultural differences are there outside of language and religion? Now, that question came in early. You all covered cultural differences related to food and immigration status, but I'm wondering, are you aware of any resources that can sort of help with various cultures, help a service provider understand what are some of the particular cultural considerations at play with different populations?
We encourage service providers to contact, like in Chicago, Arab American Family Services, United African Organization, Iraqi Mutual Aid, etc. These types of organizations to conduct in-services for staff, to better educate about cultural practices and some of the reasons why we need to phrase some of our outreach and community education differently. Those are just some of the suggestions for ways of being able to learn more about specific cultural practices. And the most important thing is to never assume that you know what the cultural practices are, because every survivor experiences their culture, their heritage, their accumulated trauma and historical trauma differently. And it's important for us to practice cultural humility and have and allow the survivor to teach us about their history, their culture, how they experience their heritage, etc. It's really important to create the space and time for survivors to teach us, rather than for us to assume that we know what their cultural experience has been.
That's great. There was a related question. This person lives in Indiana, lives and works in Indiana, where they are accepting Afghan refugees. And they are particularly interested in any suggestions or ideas about how to do outreach to that population. And I believe that the Afghan refugee group is fairly new, but
Yes, right.
you know, in the last few
Susan,
months.
Right, Susan, we're very fortunate in that I was just speaking with my executive director this morning. There is the Muslim Women's Resource Center in Chicago, which is primarily run by and for Afghan women. They are actually, the State Department has arranged for our executive director, Neha Gill, and Seema Qureshi from the Muslim Women's Resource Center, herself an Afghan woman leader, to go to one of the military bases where a lot of Afghan evacuees are living in Indiana. And they're going to be talking with them and establishing ties. There have emerged a lot of cases of domestic violence that have already been identified. So somebody from the U.S. State Department who's engaged with Upnagar in the past and under the Obama administration, was also working in the White House. So those are some of the ways to think about engaging, resources that are already here that are very familiar with and can help to engage Afghan community members, recent evacuees who are here, as well as in providing some cultural education to service providers.
Great, thank you. Another question, in some parts of the country, there are relatively few female interpreters to help with like taking statements, but males might be less effective in communicating with a female victim of, let's say, domestic violence or sexual assault. Did the research talk about that at all, the gender of the interpreter?
Thank you for that question. Are y'all able to hear me?
Yes.
Okay, thank you for that question. The research in our scoping review actually did not specifically look at the gender aspect in the studies that we reviewed, but in general, when thinking about cultural responsivity and access to services, it's my understanding that gender definitely plays an important role. So for instance, all of the domestic violence groups that I've run, it does help when I talk to female survivors or people who identify as being women, and me with my own identity and positionality as also being female, immigrant, all of those overlaps definitely does help create this environment where I'm creating a safe and welcoming space for them. But at the same time, similar to what Radhika said, one should not assume. So even when I'm working with people who look like me, sound like me, maybe even have the same, gender that they identify with, it's important for me to keep my positionality in the mix, but then also not to assume. So in general, the research definitely will point to the fact that there is benefits in matching based on research and identity. Thank you.
Well, while we're on the topic of interpreters, we have had a couple of questions that relate to how someone can find more interpreter assistance, either for therapy, which may have specific vocabulary, or even if they're in an area with limited interpreters. I know you talked about that somewhat, Radhika, but can you repeat advice,
Sure.
including trying to raise that question up to the state level to get some broad resources for all victim services?
Yeah, we should all of us who are victim service providers should be talking to our STOP and VOCA, Victim of Crime Assistance grant administrators at the state level to say, please, can you set aside funds to have an account with a language interpretation line that every single one of our organizations can access to get live phone line interpretation. Also, we need to create an industry, and maybe former survivors who are now in a position where they are able to work and provide interpretation. This could be a great economic empowerment for them to get trained to be interpreters. And yes, the National Domestic Violence Hotline also provides language interpretation via, phone bank, interpreter phone bank. And absolutely, we should all, if gender is an issue, absolutely, trying to push to find you know, female interpreters, etc., and building up and those resources. And also the Asian Pacific Institute on Gender-Based Violence organization listed in the PowerPoint. They've got a lot of great information on how to advocate for survivors who are working with interpreters to ensure that they're getting the best possible service from those interpreters. That's it.
All right, we got another question related to practice. This person is a therapist working at a domestic violence agency, and related to U visas, many of the clients ask for a letter to attach to their U visa application. Do you have any guidance for what the most important details are that a therapist should be sure to include in that kind of letter to help their client with immigration matters?
That's a great question. Our staff at Upnagar who do direct service are often doing those letters with the permission, you know, with a release of information from a survivor we're serving, and they can let you know. I'm not a direct service provider in our agency, but if you contact us at Upnagar, apnaghr.org, would be happy to talk to you about you know, some templates for the letters that they write on behalf of somebody seeking a U visa. Or remember, a lot of survivors are labor trafficked in their marriage, and T visas are easier or less difficult to get than U visas. So there is a client who was labor trafficked by her husband and his family. So she went for a T visa, a trafficking visa, which there are less obstacles, or it's less difficult to obtain one of those. So, you know, keep those in mind. But the point is, we'd be happy to talk to you about what those letters look like that our direct service staff have written for survivors.
That's great. While we are on the topic of immigration issues, we have another question. If a survivor decides to leave, and we know they often depend upon the perpetrator, and we know U visa processing takes 12 to 18 months, if not longer, what can we do for the woman or the victim while waiting for approval? And is there anything we can do to influence the processing time for those visas? And this question is not just related to practice, but in the research, was there any research that pointed to the relationship between the severity of the abuse and the type of services they seek? Oh, I'm sorry. When I started that, I thought that would be related to the first half of the question, but that was a totally separate question. So let's start with, how can we help people while they're waiting for a determination on their visa? And then we'll get to the research question.
That's a great question. I am not the expert on that, but if you were to look at, again, Asian Pacific Institute on Gender-Based Violence, National Latina Network, and then folks who are like the Vera Institute for Justice, those are organizations that are talking about safety. One of the things that we really encourage everybody to look at is who in your state or your area is looking at balanced and restorative, transformative justice options for safety and accountability to help keep a survivor safe who's like, I don't want to get that person arrested. I don't want them to be deported. And I want to be as safe as possible while staying in the marriage, etc. So what are other ways that don't involve the police, don't involve the courts, that you know, can provide more creative solutions? And Mimi Kim and the Creative Interventions Toolkit that she has created, I really encourage you to look at that. And Mimi Kim is a national leader who's very familiar with working with survivors who are immigrants and refugees. That's one of the suggestions, but also there are national experts who are legal advocates who can talk much better about what to do while waiting for the visa to try to stay as safe as possible.
Thank you. And now the research question. In the research, did you find anything that addressed the relationship between the severity of the abuse and the type of services that victims seek?
Sure, thank you. I can answer that briefly. And Kristen, if you want to jump in, please feel free. In our research, we did not see, in this particular scoping study, we did not see a relationship directly between type of abuse experience and type of services that they access. But in general, I would assume that people would, from what I've seen in my past work, I would say that people would seek services. They're more likely to seek services in case of physical abuse, because in the immigrant community broadly, if you can see something, it's violence then, and all of the other forms of abuse, such as, delayed access to food or, taking away immigration papers, it almost seems like it's cultural. And a lot of times when I've talked with survivors or other friends and family members, I've often heard them say that this is just bad behavior, this is not violence. So why do we need to go and seek help? So in those cases, it's important to sort of empower bystanders. So if your friend or family member were to come and say this to you, it's important for you to understand that this is not bad behavior. This is domestic violence. It's not okay for your in-laws to have control over your reproductive rights. It's not okay for them to not give you food. So it is important for you as bystanders to be empowered and direct people experiencing abuse to the right resources. Kristen, anything you'd like to add?
I think you covered it. That was not something that we specifically saw in our research, but I think you spoke really nicely to it about from your own experiences.
We have another research question, and that is, were rural or small communities looked at in the research regarding services availability?
Thank you. We did have, yeah, Kristen, go ahead.
I was just going to jump in there. We, because of the kind of the aggregate nature of the studies that we included, they were more, they tended to be more vague in terms of reporting where in the US that it was more regional information, unless it was a large city like Chicago or New York. I would say predominantly it was, it seemed to be more urban. Dr. Rai, was that your impression as well?
Yes, that was my impression as well. But, for some of these interventions that have been made to be culturally responsive, it is my understanding that those interventions, most of them are publicly available, or if you were to contact the author and ask them if it can be replicated across rural communities, that could be a good way for people interested in doing this type of work in rural communities. But in the research, we predominantly did see a focus on urban areas.
Thank you. We have another question for Radhika, and that question is, in working with South Asian domestic violence victims, have you seen abandonment as an issue? And what are some of the options available to survivors in that situation?
Okay, well, there's domestic abandonment and transnational spousal abandonment. That is such an issue that it now has this term, transnational spousal abandonment. There are clients of ours who have called up and said, we went back home to visit family. I woke up, he's gone. He took my passport. I have no money. I don't know any way to get home. And so our legal advocates will work with the U.S. embassy or consulate in that country, and help them to reestablish their credentials, their immigration papers, and then find a way to raise funds to help bring them back home. Abandonment here in the United States by an abusive partner, absolutely, that can happen. There was a case of a South Asian man who brought his wife and unloaded her and her luggage and drove off. And so, at our offices. And so, yes, abandonment does happen. And so then it's a matter of just, helping them to explore their legal options for, child support, spousal support, economic empowerment, all of those things. Absolutely. And sometimes being abandoned within the marriage. I came over here thinking I was, entering into a marriage of good faith. I came here, found out that he has a girlfriend, he lives with her, and I'm essentially a domestic servant. Finding out what your rights are. It's really, really important, and also knowing what all of your options are for economic support. A big problem with many survivors who come to us is that they weren't raised to, be able to earn for themselves and to be able to negotiate travel and driving and public transport and English skills, etc. They were disempowered in their gender socialization. So, it's really, really difficult having to work on figuring out how they can economically sustain themselves. It can be even more challenging.
Thank you.
And
All
may
right.
I add something,
Oh, yes.
Susan?
Yes.
Along the same lines, I also wanted to add and say that because of some, the gender socialization that Radhika was talking about, a lot of us, and I say us because I'm an immigrant, so I'm going to talk a little bit about my experiences. I feel like we hear a lot that, boys don't cry, and because of which I feel like a lot of times domestic violence somehow becomes this issue that only one gender or with female identifying individuals experience. And while that may be true, women may be disproportionately impacted, and the research says that, but it's also important for us to understand and think about creative ways in which we can allow everyone, irrespective of their gender, ethnicity, identity, to talk more openly about their experiences and have open conversations around normalizing the fact that they could experience domestic violence and it's okay to talk about it.
Thank you. We have one last question, and this has research and practice implications. One of our participants says she worries that some agencies are becoming more inclined to use technology apps or chats, but there may be issues of technology access and literacy. Have you come across anything in the research, or from a practitioner perspective, is there anything agencies can do to address that?
Kristen, did you have anything on that? I have some ideas, but Kristen, did you?
Sure. I was going to share that, yes, there is some research coming out around the helpfulness of text-based and chat-based interventions for survivors who may not be able to access the phone, especially during the pandemic. We were seeing that this was actually a very helpful way for survivors to reach out to different agencies when it was not safe to call on the phone, or they didn't have the opportunity to leave. That's drawing on some information that I have and some previous research that was not specifically South Asian, but more broadly. But Dr. Radhika, if you'd like to follow up, that would.
We're finding some really interesting practices. Oh, sorry, go ahead, Abha.
No, I was just going to chime in and quickly say that yes, during COVID, we did see some interesting research that came out where survivors were unable to actually make phone calls, or they did not have, computers or time in the day to actually type out emails and look for websites. So text-based services were definitely helpful, where they could send a message and then receive help. And messages were sent using code words such as lipstick, weather, or something like that, so that they're not drawing a lot of attention to saying that they're experiencing domestic violence in the event someone was to discover that text and then put themselves in dangerous situations. So this is definitely something we've seen come up in the research, especially during the pandemic. How does this look like in practice, Radhika?
In practice, it's really important to ensure that, and to get the word out to people that if you are in pandemic conditions, isolating at home with a person who is harming you, you can do silent outreach, yes, such as texting or emailing. For us, we have a text hotline phone number, and we also have help at Upnagar. You can write an email to us, to our hotline, without, being audible. We also remind people if the persons who are harming you are also surveilling your phone, trying to find out if you can borrow a phone, if you can borrow a phone or a cell phone or a regular phone to call a hotline, going to the doctor's office, making up an excuse to go to the doctor's office and trying to use their phone, or going to a store and using a phone there to contact a hotline, finding ways that you can contact and get help from a hotline without risk of being found out by somebody who's harming you and is watching your phone and looking at your phone records and all of that. And then also remember that many immigrant communities use apps such as WhatsApp And that can be a great way to disseminate information that people can then use through WhatsApp to disseminate, your flyer for your organization, to many people whom they know who are out in the community. So sometimes, finding out what particular apps, cell phone apps, many immigrant and refugee communities are using and using those platforms to get information out about services, and that free confidential services are available for everybody regardless of immigration status. Contact this number.
Well, that's all very hopeful news. First of all, that that technology proved to be so useful during COVID, and that there are so many creative approaches to finding ways to make the use of technology confidential and safe for people. I believe the questioner was also thinking, though, about those who have either low or no literacy skills. Let's say it was the Rohingya, whose language I just learned today from you all is not written. Or maybe new immigrants who don't even have access to a cell phone. I think she's concerned that there may be so much effort to drive providers to rely on this kind of technology, which does not work for all survivors, and some survivors may therefore be left out.
Absolutely. For those who are most isolated, Abha's point about the importance of bystanders, making sure that congregational leaders, social service providers, schools, medical care providers know to reach out to people and say, you can use our phones. This is an issue, and also encouraging community members, if you hear a conflict next door, make up an excuse to go knock on the door and just say, oh, there's a lot of noise, or is your Wi-Fi working? Mine isn't. Those are some of the ways that neighbors have just chosen to intervene and kind of let them know, hey, I'm here. So, these are just some of the many ways in which people can support those who don't have access to phones and don't otherwise, have computer access, et cetera. And also reminding people, you can go to your public library. Most public libraries give access to computers, and ask the librarians to help you. Librarians are information goddesses and gods. They can also be really, really helpful as well.
Well, I really want to thank you for that final comment, because our research librarian at the Center for Victim Research has been sending a couple of additional resources to me. So I do want to remind people, you can reach out through victimresearch.org to our librarian and ask her for additional resources. I want to thank the three of you. This has really been informative, and you can tell by the number of questions that we got that the audience was really engaged. And I'm seeing so many thank yous for this terrific presentation. I'm seeing awesome job. People excited to share this information with those that they work with or their partners in the community. So thank you all so much for sharing this information with us today.
Thank you. Thank you for inviting us, and thank you all for attending.
Yes,
absolutely.
All right, everyone. Remember, if you complete that survey, you can get a copy of the slides, and that will include the email addresses of our speakers if you have follow-up questions for them. Thanks so much, everyone. Enjoy the rest of your day. Goodbye.